Good afternoon, everyone. I would like to welcome all chapter members and Pennsylvania listeners, pediatricians and all physicians, nurse practitioners, physician assistants, nurses, practice managers, office staff, and others to today's webinar presentation of the Let's Talk 2020 Census, the health impact and how you can promote it in your office, presented by the Pennsylvania chapter of the American Academy of Pediatrics in partnership with Pennsylvania Partnerships for Children and the U.S. Census Bureau. I am Samantha Pierpoint, Communications and Community Engagement Coordinator for the PA-AAP. This webinar will be recorded and the webinar link will be emailed to all participants and available on our website, www.paaap.org. Please note, CMEs and CEUs are only available for the live program. Information on obtaining CMEs and CEUs will be emailed to all participants following the webinar. Information presented in this webinar is educational in nature and does not necessarily represent the views or policies of the PA Chapter AAP or UPMC, the accrediting organization. Slides were emailed to each participant, but if you did not receive them, you can download them as you see in the box to the right. Additionally, all resources, links, and handouts mentioned today will be shared with participants following the webinar. If you have any questions throughout the webinar, you can type them into the Q&A box to the right-hand side of your webinar screen, and we will leave time to address them at the end of the webinar. Our first presenter today is Dr. Trudy Hecker. Dr. Hecker is the Vice President of the Pennsylvania Chapter of the American Academy of Pediatrics and the Medical Director of Global Patient Services at the Children's Hospital of Philadelphia. As the Medical Director of Global Patient Services, Trudy oversees all medical care for CHOP's international patients upon acceptance to discharge. She coordinates with CHOP faculty, referring physicians and patients and families to provide high-quality pediatric health care. Dr. Hecker has over 20 years of experience as a general pediatrician, pediatric physician at CHOP and has worked in establishing CHOP's primary care network as well as serving as medical director for quality and patient safety for the CHOP ambulatory network. She is also the medical director of the Reach Out and Read Greater Philadelphia programs. To meet CME requirements, please be advised that Dr. Hecker does not have any financial disclosures to report. So we will go ahead and get started. Dr. Hecker, please take it from here.
Thank you so much, Samantha. I appreciate the opportunity to speak to you today. We're very excited to have this webinar today. Our initiative About Every Child Counts is a collaboration between the Pennsylvania chapter and the national AAP to support the completion of the next U.S. Census. They're working closely with pediatricians and health professionals and partner organizations joining us on this call today. The campaign aims to educate healthcare professionals about the 2020 census, support the role of healthcare professionals like us in promoting the 2020 census, and ensure that all families receive accurate information and guidance from a trusted member of their community. We're joining forces today, particularly with partners of the Pennsylvania Partnership for Children, as well as the U.S. Census Bureau, and we hope that you will all share this with your healthcare systems if you're part of them or within your practice, as well as the AAP. And we really need your help on this project as trusted voices in your community. You really play a key role in raising awareness for the 2020 census, that it's easy, safe, and incredibly important for our country. The 2020 census is required to be performed this year, as the census is a constitutional requirement, so that every 10 years, everyone living in the U.S. needs to be counted. It will begin April 1st, 2020, and run through July into August as well. You can respond by internet, phone, mail, or in person. And the questions are basically around the name, ages, a phone number, sex, whether they're Hispanic origin, race, the number of people living in the household, and whether the home is owned or rented. There is no requirement to declare your citizenship or your Social Security number, and the data is kept incredibly secure. The reason this is so important is it really does allocate our political representation and will redraw districts, particularly in Pennsylvania, for our U.S. House Congress seats, for the state legislators, even for counties and for local school boards. As importantly, this census data will also drive federal programs that then allocate federal funds, up to $700 billion of funding. That provides an estimate for us as pediatric providers for the number of local children. So the 2020 census will impact the federal funds that our communities in Pennsylvania receive each year for programs and services that are critical for children. special education, school lunch, WIC, child block grants, Head Start, Early Head Start, Medicaid, CHIP programs, and foster care services. But in addition, it also is very important for many funders and foundations to do their nonprofit research and quality improvement. For example, the Annie A. Casey Foundation does its All Kids Count data based on census data. So what we know from the last time the census occurred in 2010 was that 1 in 10 children under the age of 5, so from birth to 4 years of age, were missed in the 2010 census. That was more than 2 million uncounted children. Those large undercounts in the 2010 census meant that at least a $500 million, if not more, a year for Medicaid and CHIP programs were really missed by the different states. A small example is almost $1,700 per child per year for schools as a national average was missed by local school districts. So over a 10-year period, that was over $17,000 per child per school district. So the implications of not completing the census and getting accurate data is crucial for this country. Who do people trust? So people who speak for the children or the schools were especially respected as messengers. This was a NALO study, which was the National Association of Latino officers, and that is done routinely. And again, we as pediatricians, doctors, nurses, family practitioners, healthcare providers are really high trusted sources of information for our families. And so as pediatricians, what we want to do is to be able to advocate for kids, and we want to be able to make sure that we're using our offices and our influence with our families as trusted providers of information and care in a positive way. So we ask that all of you become informed, so thank you for joining us today. You can display materials in your office. You can wear your pin, which the AAP has been setting out. You can use social media. You can talk to the families. You can remind them that the infants count. That is the most important piece. Many people will fill out their survey, but then again, they will not have the ability to have the infant on their lap be counted. So any child born up to April 1st should be counted. And that's an important reminder again. And then connect with your local census person as well. More to do is that you can write your op-ed for your local newspaper. You can appear on any television or news radio stations or present at community opportunities, maybe perhaps your hospital local grand rounds or your residency program if you are part of an academic health center. We are here to help as a Pennsylvania chapter, so we can help you connect. We have people that can help us connect with local media outlets. They can give us talking points and statistics, and they can review and provide input on the written publications and join you in in-person presentations if needed. This is an example of an op-ed that was done by Dan Taylor, who's at St. Christopher's Hospital. It was published in the Philadelphia Inquirer and gave the whole opportunity to talk about the census tract surrounding our hospital, which is St. Christopher's in Philadelphia, is ranked as one of the hardest to count in the country. Only 71% of households were counted in 2010. And that was a very, very powerful opportunity for him to publish this in our local newspapers. So please feel free to reach out to us as a chapter. Also, we have an advocacy committee, so this is my chance to plug that committee. It's very important to reach across the state of Pennsylvania, looking at issues of health equity and access, immigrant health, immunizations, gun safety, the opioid crisis that's going on now, or just practice-related issues around funding and telehealth that's coming up now very poignantly in the recent days. So this is the resources. This is our page. This is the what you can do on becoming informed. And with that, I'll end my presentation. Thank you all for joining.
Thank you very much, Dr. Hecker. Our next presenter is Rahina Morrow. Rahina is the Delaware County Partnership Specialist with the Philadelphia Regional Census Center at the U.S. Census Bureau. To meet CME requirements, please be advised that Rahina does not have any financial disclosures to report. We are very grateful for Rahina joining us today on our webinar and sharing this important information. Rahina, please proceed.
Thank you so much for giving me the opportunity to talk about this most important issue to, particularly as Dr. Hecker said, to our children. Like she mentioned, children under the age of 6 are the ones that are counted the least. They are the most underrepresented in every decennial count. So it's critical that we do all possible to communicate the importance of responding to the census. What I'd like to do is give you just add a couple more points about the census that have not been mentioned already. I want to share with you the biggest challenge that we are facing, why we're here, how you can help, and then we can have some Q&A. The only other points I would like to add, besides what Dr. Hecker mentioned, is the fact that we have been doing this for 230 years. The responsibility to count every single person in the country is in the Constitution. It was added in 1787, came into effect in 1790, and we've been doing it every 10 years. Now, the biggest challenge that we face is non-responders. Now, I'm going to go over who they are, where they are, and why they don't respond. So what we find, there have been extensive studies performed by the Census looking at different demographics and trying to figure out who are the ones that contribute the most to the community's undercount. We find that they come from all different walks of life, all different demographics. We have foreign-born residents. We have people in low-income households, the undocumented population, those who do not speak English well, homeless, renters. Renters are very, very important. I'll talk more about that later. Those without internet access, highly mobile groups, select rural areas, and the last two are connected, children under the age of 5 and young heads of household, for obvious reasons. What we tend to see is the parents of the children that are 6 and under tend to be between the ages of 18 to 34, and those are the ages where they tend not to respond for the household. So where are they located? Excuse me, this is a map of Pennsylvania. It's available online. It's a response outreach area mapper available through census.gov, and it's color-coded. Basically, the darker the color, the lower the expected responses for those areas. So you can see that even though we have some zones that look pretty dark, you see that around Philadelphia, around Pittsburgh. It's actually, we have concerns to varying degrees throughout the state. Okay? Why don't they respond? There are 3 main reasons, or a combination of: people don't know how easy it is to respond, how safe it is, and how important. So let's go over easy. The census questionnaire only has 9 questions. That's all it is. It asks you for your name, your date of birth, your race, sex, ethnicity, who lives in the household, and the same questions of that person, in addition to how are they related to the person responding. If you have somebody who lives in your home, but they're not related, they would also be. The key thing is, as of April 1st, who lives in the house most of the year? In my case, for instance, I have 2 sons that are away in college. They are away most of the year. They would not be included in my form. It's very simple. Again, only 9 questions, and it pertains to people that live under the same roof most of the year. It is available in several languages. We have a questionnaire in English. We have 12 non-English language questionnaires. And if the person's language is not one of those 12, we have an additional 52 language guides that can be accessed online, and to enable the person to respond to it side by side with the English one. It can be completed for the first time via the internet, and it's a very, very simple, quick way to respond. And it's also one that we encourage everybody to use. What we have found is that our data scientists tell us that we tend to compile a lot more complete information when people respond online. So we encourage that. You can also respond via telephone or mail the form. SAFE. And this is the one that it has gotten a lot of press coverage, concerns for the safety of the information. Title 13 requires the Census Bureau to keep all information confidential and protected. Other government agencies, being the Internal Revenue Service or Immigration, Health and Human Services, they do not have the right to obtain information from the census, nor are we allowed to disclose it to them. This also extends to landlords. They don't have the legal right to access it. Remember that I mentioned renters earlier. One thing that the study found is that when people have a concern as renters that their landlord may find out that, in fact, they may have more people living in the dwelling than they disclosed in their application, they're concerned that they may be evicted. It's extremely important that we let renters know that the information is not available to their landlords. Also, the census employee, because those are the requirements for the Census Bureau. But what about census employees who may violate this provision? What if one of our census takers were to take information obtained and sell it to somebody for, it could be for the commission of identity fraud and what have you. A census employee who does this faces a fine of up to $250,000 and a prison sentence up to 5 years. So needless to say, there is no incentive whatsoever for any employee to be disclosing personal information. Also, by law, any responses given cannot be used against a responder by a government agency, in a court, in any way, shape, or form. The one thing that I would offer people that still don't trust that the information is kept safely and confidentially is, again, we have been doing this for 230 years. I would venture to say that if at any point somebody was impacted negatively by information that came from the census, whether somebody got evicted or the IRS found them or law enforcement, immigration, I'm pretty sure we would have heard about it. Important. This is something that I myself was not as aware of before I started working for the census. I knew the importance as far as political representation, the fact that how many representatives the state of Pennsylvania gets, it depends on the people that were counted in Pennsylvania. I started working for the census. I knew about the political representation component of the census, and I knew how important it was. Unfortunately, I have to confess that it was never enough of an incentive for me to put everything aside and complete the census when it came in the mail. I want to cover the two, besides that, I'm going to cover the areas that are impacted, and these are things that impact people's daily lives. Billions, hundreds of billions of federal funds are allocated according to how many people enumerated in the state. What we end up dealing with is that if we have non-responders, that leads to an undercount, that leads to underfunding. The best way I normally explain to people is the following. If we end up contributing to, let's say, a 10% deficit for Pennsylvania, in essence, Pennsylvania would be telling Washington, we only have 9 people here. And Washington turns around and says, okay, here is money for 9 people, but we have 10 to take care of. It is extremely important that we raise awareness in the community of just how much it matters that people self-enumerate, that they respond to the census. The second component that is hardly talked about is community planning. Our city planners rely on census information to determine, according to population trends, where is our infrastructure going to be in need of improvement or expansion. It could be
our hospitals, it could be our schools, our roads. The only way they can make accurate planning, efficient planning, is by having good numbers. Non-responses lead to an undercount, leads to an being under-resourced. And again, I want to emphasize the fact that this count that is going to be obtained for 2020 doesn't just affect us in 2020. We're talking about decisions that will be made for the next decade. Business planning, economic activity. I myself in the past owned a couple of small businesses. Census information is available online. It's free. And I used it myself to be able to find out where my clients are. I'm Hispanic. One of the services that I offer was very appealing to Hispanics. And the first thing I would do was try to locate where there was a concentration of Hispanics, where my clients would be. So it's all these things. When you have non-responders, it leads to an undercount, it leads to underserviced. Now, I want to share with you some of the highlights from that BAM study I referenced earlier. And I'm going to focus on the general population, the 18 to 34-year-old heads of household, and households with children under 6. Barriers. Skill set, whether it's language skills, reading skills, that's a barrier for general population. General unawareness. No internet access leads to less access to information. We found that non-Hispanic Asians and less educated households tended to be the ones that were the least familiar. But a big group was 18 to 34-year-olds heads of household, where you can see that these bar graphs are divided by age groups. The younger the age group, the least familiar they were with the census. Attitudes. Mistrust of the federal government. Most concerned are Native whites, Native small sample races, and Native blacks. Least concerned were foreign-born Hispanics and Asians. Concerns about confidentiality. About a quarter of those surveyed expressed being very concerned or extremely concerned information could be used against them. General apathy. Again, 18 to 34-year-olds tended to report the lowest likelihood of filling out the census. Motivators. Funding for public service was a top motivator across all groups, yet less than half of the respondents knew that the census is used to determine community funding. Top 3 motivators: schools, fire departments, police department. The fact that it contributes to a better future for the community. It provides information for planning, as we were just talking about. Bottom motivators. I found it interesting that we do hear a lot about the importance of political representation, yet a very small minority of the group found it to be a motivator enough to complete the census. Funding for public services. Nearly 7 in 10 householders ages 18 to 44 indicated community-oriented use of the census would be most important to them. So if you remember back the other 2 graphs, we have them being the least aware, therefore the least likely to complete the census, yet they were the most motivated. When they were told what the census was for, they were the most motivated of any age group. So we're dealing with a major problem of general unawareness of the importance of the census. How familiar are you with the census? I'm just going to cover 2 more questions here. Households with children under 6, were they least familiar? And how likely would you be to fill out the census form? Again, households with children under 6 were the least likely to fill it out. So why are we here? As members of pediatric healthcare services organizations, you are trusted by your clients. You are accessible to them. You understand the ease, safety, and importance of responding to the census. And you have resources that are critical to outreach. How you can help. You can become a catalyst for change by formulating your message tailored to your audience. Use census resources. Encourage people to apply for census jobs, and I'll touch a little bit more on that later. Leverage your resources. Stay informed. Share information. I'll cover each one briefly. Formulate your census message tailored to your audience. Understand, given everything we've been discussing, there are possible barriers and objections to participation, whether it's somebody who's renting, whether it's somebody who's just young and unaware. Try to understand what their motivators or their barriers or objections could be. Apathy or mistrust, ability or language concerns. Consider making your message very simple and visual, relevant, and personal. Here's an example of a half-page flyer that we have available for download from our website. It makes the point to see the mother with the baby. It briefly explains how important, safe, and easy it is to respond to the census. Use census resources. We have a great amount of PSAs and videos on our YouTube channel. In this link, you have flyers, fact sheets, and posters that you can download. You all have a local U.S. Census Partnership Specialist. I happen to cover Delaware County, but the Census does have a representative in every single county throughout the state. Encourage people to apply for census jobs. Promote it as an opportunity to generate extra income. It's a part-time, temporary position. It pays between $14 to $27.50 an hour. It depends on the county of residence. Flexible hours, weekly pay, paid training, reimbursed mileage. This is critical also to ensure that we get a complete count. For those that do not respond to the mailing invitations to enumerate themselves, we are going to have enough census takers to go out and knock on doors to be able to secure the information. Leverage your resources whenever possible. If you have any space, consider hosting a census briefing session. You have a community communications platform. Incorporate census information into your newsletters, your emails, your social media, your website. Bulletin boards, wall, door displays, you can just download some of the flyers or posters that we have online. If you're having a non-census related event, consider incorporating census information into it. It could be something as just briefly for 5 minutes talking about it, or you may have an information table available for people to learn more about the census. But consider including census information into your non-census related events. You have a network of additional resources, trusted, influential voices, people that are not on the call. Encourage their participation in outreach. Stay informed, share information. 2020census.gov happens to be a very good website. It has a wealth of information, regardless of the topic or regardless of the concern, it's addressed there. Why it's easy, safe, and important to respond. What is new for the 2020 census? Remember, it's the first time that we are offering the online option, and we encourage it. Important dates and what to expect. Between the 12th and the March of this month, the first wave of mailings is going to go out. That is the first of 5. So there's a total of 5 mailings. If the person does not respond after the 5th one, that's what's going to prompt the door knock. And by then we're going into May, between May and July. Census takers begin visiting homes that did not respond to the 2020 census. Be prepared to answer questions. and address any concerns. And with that, I conclude. Thank you very much for your attention.
Thank you so much, Regina. Our last presenter is Carrie King. Carrie is the President and CEO of Pennsylvania Partnerships for Children. She is responsible for the organization's daily administration and effective functioning and is directly involved in the organization's interaction with state-level public policymakers, Pennsylvania's congressional delegation, the news media, the Children's Advocacy Committee, funders, and service sectors. Prior to her role as President and CEO, Carrie was the Vice President of the Public Policy for PPC, leading PPC's government relations efforts and overseeing the organization's policy development and implementation work, and representing the organization before the Pennsylvania General Assembly, state agencies, regulatory bodies, and Pennsylvania's federal congressional delegation. Carrie joined PPC in April of 2015 after serving in various positions in former Governor Tom Corbett's administration, starting as the legislative director for the Pennsylvania Insurance Department. From there, she was promoted to Deputy Secretary for Legislative Affairs in the Governor's Office and ultimately rose to the position of Deputy Chief of Staff. As Deputy Chief of Staff, Carrie concentrated on healthcare, insurance, and human services issues in the Governor's Office. And prior to entering state government, she worked in government affairs for a 3-state trade association representing insurance brokers, as well as for the Pennsylvania Chamber of Business and Industry. Carrie is a graduate of Susquehanna University with a Bachelor of Arts degree in Political Science. She earned a master's degree in Political Science from Lehigh University, and she resides in New Cumberland with her husband, son, and daughter. To meet CME requirements, please be advised that Carrie does not have any financial disclosures to report. PAAP is very lucky to have the opportunity to collaborate with PPC on this important initiative. And Carrie, thank you for presenting with us today, and you may go ahead with your presentation.
Thank you so much, and thanks for having us. And I just want to start by talking a little bit about the partnership that's existed over time between PPC and the state chapter of the AAP. Being based in Harrisburg, when you look at our first slide here, we talk about being this trusted voice to improve the health, education, and well-being of children in the state. And, really when we talk about what PPC is and what we do, it really comes down to advocacy for kids. And being based in the state capital, we do a lot of state-based work. We also do some federal work. But for us, it really comes to educating policymakers, whether it's in the legislative branch or in the executive branch, and working in coalitions to develop public policy that we're then trying to advance. And oftentimes when we're doing work in the healthcare space, over many, many years, one of our trusted partners has always been the AAP. So it's been a really neat project for us. While the topics have usually been, reducing the uninsured rate or things like that, it's been nice to talk about something a little bit unique in the census. So I'm really pleased to participate today. And as we also note here, we're part of the Keystone Counts Coalition, and that's been a pretty diverse group that's been brought together and is also working in concert with the Governor's Complete Count Committee. I also want to make a note there, too. While our public policy agenda is pretty broad, both in terms of policy areas, so we do work on children's health, but it then extends into early childhood education, K-12 education, and child welfare. We really do center our work based on data and what the data tells us. So we're the state grantee for the Annie E. Casey Kids Count Foundation, or the Kids Count Network. And really that is centered on about 150 or so indicators of child well-being. And so we have in-house expertise that lets us work in some ways with the state, but other areas where we're able to get data and then be able to synthesize that and really then turn it into materials that are essentially focused at policymakers and using that data to persuade them to advance policies to benefit kids. So it's been a nice intersection here, again, with the census, where we're able to take different data points and explain why the census is so important, And there's a really nice intersection again there with our embedded health policy work, and explain how, funding streams, for example, that impact health programs, and how that has a direct interplay into the census. So with that, I think we can move on to the next slide, but I just wanted to give kind of that base understanding of the work that PPC does and really our long partnership that we've had with the AAP, and working from an advocacy perspective in the state. So some of this material has been touched on from the previous presenters, so I'll cover it a little bit more quickly. But we talked a little bit about who is the most at risk of being missed in the census, and you can see the map there in terms of a geographical perspective. And in some ways, certainly this can quickly become in the context of the discussion of a rural-urban context, but I think it's a little bit more complex than that. And I think the map, when you have more of a visual representation, can explain that. But it's also much more of a broader discussion than that of just geography. So you can see there in the bulleted list where it certainly does get to kids, and really that's been the perspective that we've brought to the coalition that we're involved in. We are the voice for kids in that coalition, and the how many kids were missed in the last census. But beyond that, as we talked about, immigrants, people of color, certainly there is a rural perspective here to this. It is not just an urban issue. Low-income households, and then obviously the homelessness perspective that was covered. And I also want to highlight too, when you look at the map and you see kind of those bright red areas, that's kind of the most eye-catching. But I also think it's interesting as you see that kind of expansion out into some areas of south central Pennsylvania, going into the northeast. I think it's interesting when you see that kind of spread geographically. So if there are folks that are participating today, I just want you to kind of take note at the trends there and what you're seeing. So as we've been talking about outreach efforts within the coalition and working with the administration, and I know the administration has been doing some targeted like press events, and just trying to create greater awareness in certain pockets of the state. They've actually been targeting those events in certain places just because they have been identified as those priority counties. We can move on to the next slide. So getting a little bit more specific in terms of what does it mean if we miss kids. So really, to boil it down most simply, I think it really comes to one of the pieces is largely a fiscal issue. It's reduced funding, and it applies to all communities across the state. So while we just talked about some of the areas geographically that are at the most risk for being missed, at the end of the day, the funding would impact, it would be a statewide issue. And we've really been trying to drive home to both lawmakers and businesses that it's incumbent on them to also be concerned with this issue, because the decisions that they then make are then impacted because they rely really on that accurate data, the accurate population counts. And if it is not accurate, their ability to make those decisions are then compromised. So just recapping again very quickly, in the 2010 census, just over 25,000 kids across the state were not counted. And when you really get specific in terms of that fiscal impact, it's about $45 million that were lost in federal funding. Or more specifically, in terms of per child, it's just over $1,700. And we talked a little bit about some of those specific programs, but again, just recapping really quickly. Of course, for the audience today, certainly a direct impact there for Medicaid and CHIP in terms of healthcare coverage, but even getting into some other areas like foster care and adoption, special education, and child care programs. A quick note too, we did quite a bit of advocacy work throughout 2019 to get specific state dollars allocated for census outreach work. There was nationwide a push of several states, I should say more than several, quite a few, to get state-specific funds for census outreach efforts as we headed into 2020. And it was a little bit of a back and forth during the budget process. And actually, it was pretty interesting. It was actually not accomplished by our budget deadline of June 30th. But when the legislature came back, since we do have a full-time legislature, one of the benefits of that is that they came back in the fall, and discussions continued, and there were some bills that were moving at the time, and we were able to get some funding after the budget passed, so more into the fall, that did allot $4 million for outreach. So we were very appreciative of that, especially just kind of the interesting timing and process that it took. Not all states are allocating funds. And so while the initial ask of the coalition that we are in was higher than that, we were hoping for somewhere in the region of about $10 million. We're certainly appreciative that funds were realized when knowing that some states are not doing that. So state funds have been allocated for this specific outreach and are now being utilized. And it was actually a pretty concerted effort on the parts of the stakeholders that have been engaged to be able to accomplish that. Moving on to the next slide. So I'm going to get into some of the specific populations then within, specifically with kids, that we've been trying to tease out in terms of really honing in with outreach as we get closer and closer to the census. And one of them is infants or babies. And this has been, for me personally, one of the surprising things that I've learned as we've become more engaged in our census work is just that there's some of the population, there's this misunderstanding that if you have, for example, a newborn, you might not need to count that baby, which is not accurate. So we're just trying to drive that messaging that, yes, the baby should be counted. But again, just in terms of that fiscal impact, so as we were covering those programs, a lot of those services help families give babies a strong start, and they're reliant on those funding streams. And I know I'm preaching to the choir here, but research shows that families are not always aware that babies should be counted, and they should be. But it's really important because those programs are starting services for young children, and as we all know, it's those early years of life that are so important in terms of child development with brain development and really setting them on a path for future success. So if the funds aren't available for those programs to really get into homes early, get into things like home visiting, which is something that we work on quite a bit. So there's a multitude of different places that can be missed, or even, well child visits. It really is setting up kind of a domino effect then that we're not going to be setting children on a path for future success. Something that we found, I think, that has been pretty effective in terms of messaging is just, we talked quite a bit about, this is once every 10 years. And from the perspective of childhood, that's a pretty big chunk of time when you're looking at, especially through the eyes of kids, but then just thinking about the time that you have in a kid's life. So we're saying if you miss the counting a child in this census until you get to the next one in 2030, you're missing most of that child's childhood. So we're using some of that messaging in our materials about just how large of a portion of their childhood lapses from one census to the next, and how impactful it is. And again, just encouraging not just the importance overall, but that we need to ensure a full count. Let's move on to the next slide. Another subset within the child population that we're really trying to highlight is children of color. And again, we talked about some of the messaging around this and some of the sensitivities around this in terms of mistrust. So we'll go over some of these pieces a little bit more quickly, but it certainly is historically one of the more undercounted groups in the census. And it really is, in terms of African American, Latino, Asian and Pacific Islanders, and then Indigenous peoples. And I think it really kind of gets to, again, the historical and equitable treatment from government that has really that embedded mistrust of government. So it, I think, is not certainly going to be overcome just in one census in 2020, but it's something we're going to have to continue to address over time, and it's going to be much more of a long-term strategy in how we address this. But there are a variety of factors that are contributing to it, and I know that the U.S. Census Bureau has certainly started to implement some of these approaches that we can at least see some improvement in terms of trying to address the undercount. So, for example, the pieces that we have listed here in terms of internet access, obviously the issue of non-English speakers and being able to have materials available in languages other than English. And then just the fact that in Native countries, they might not do a census. So just, kind of the basic premise that they have, they're not familiar with the concept of census, and therefore just not trustful of being asked to take one. The third that we're kind of subset that we're trying to highlight is children with disabilities. And from a perspective of that fiscal impact, this is certainly a very large portion of that. So you can see here about $800 billion a year in federal funds would directly impact children with disabilities. So you can see here Title I grants and IDEA specifically, but then again, I'm sure the group is very well aware of this, direct impact in terms of children enrolled in Medicaid, huge fiscal impact there. But there's also community-based organizations that offer things like independent living services, food and nutrition assistance. So while there's some really big fiscal impacts in very large programs like Medicaid, it's also important to note here just the breadth as well of how many different areas would be impacted fiscally. It was really interesting to see this week in Harrisburg. We're in the kind of the phase in terms of the budget cycle where the governor proposed his budget address in early February, and then after that the different agencies appear before the House and Senate Appropriations Committees. And so the Secretary of the Department of Human Services was testifying before the House yesterday. Last week she testified before the Senate. And so a kind of a common theme, and it's been like this for several years, where we've had these environments of constrained budgets, but it certainly is present again this year. But it, as you can imagine, it always is in the eye of members in the legislature, cost drivers within the DHS budget. And one of the largest, or really the largest cost driver, is the Medicaid program. And so a lot of the focus and the dialogue back and forth with the members and the secretary are, and some of it is, frustration on the part of the members of, why aren't you trying to do, what are you doing to curtail costs? The frustration that they keep coming back and asking for supplemental appropriations to keep up with rising costs. So there's this kind of continued focus on what is growth for costs in the Medicaid program. Now that's, certainly for a variety of reasons, but we've also been trying to kind of highlight again this tie into there's a mounting fiscal pressure on the state to cover what are really essential services. And this has, like I said, been an ongoing issue in several state budgets, and it's a really good timing-wise, at least from the perspective of the census, where we can say to members, this really reinforces that we have to make sure we count every single person because we need absolutely every single cent that is available to us from the federal government. The appropriations process has not been easy in Harrisburg, and it certainly is these programs that we've highlighted here in terms of the direct impact from the census that is driving those costs in the state budget. So I think that has really kind of caught the eye of members and policymakers in Harrisburg, but it's definitely been kind of top of mind here in the Capitol the past couple of weeks through the appropriations hearing process. And then the last subgroup that I'll pull out for a brief mention is something that we've worked on. Again, as I noted, we do policy work in the child welfare space, is actually with grandparents raising grandchildren. And so there's been an increased attention, again, at a legislative level, but I think just generally in the public with what has been termed grand families. I think partly because of the opioid crisis, that certainly has fueled a lot of legislative interest with some bills that have passed in the past few years. If you have a parent that is seeking treatment and a grandparent, or it can be an aunt or another family member, but oftentimes you see a grandparent stepping in to care for their grandchild. And oftentimes this is an informal arrangement. It's not that the grandchild is formally placed into the foster care system per se, but it might be a temporary informal placement. But these grandparents are stepping in to raise the grandchild. What might be for a short-term situation, but it might sometimes turn into a much longer-term scenario. So we're really trying to reinforce there's, again, this level of confusion where if it is something that is short-term, the grandparent might think, well, maybe I shouldn't be counting this child because it's temporary. So you can see here in terms of the numbers, there's about 107,000 children living with adults who are not their biological or adoptive parent. And 11% of young children live with a grandparent, and that number is rising. Racial minorities have a larger share of young children living with a grandparent. That's the head of the household. And right now, approximately between 6,000 to 9,000 children are in the foster care system. That number can really fluctuate quite a bit in terms of entries and exits. So that's why you see that that gap in terms of between the 6,000 to 9,000. So it's that population that we're really, again, trying to get to in our outreach efforts because it can be confusing, like I said, when you have these complex living situations and there's that uncertainty if that child should be counted. So just another population that we're trying to reach out to and provide information to address any of those concerns. And then the last slide, really just reinforcing here, since I know we covered some of this information, how you can help. I really think, that this was touched on before. You really are trusted messengers as pediatricians. PPC, we're a little bit unique in the advocacy space where we don't have the ability to do kind of that on-the-ground grassroots work. Since we're not a member association, we don't do direct service, and that's why we do so much work in coalitions, so we can partner with groups like the AAP and, connect directly then with folks like pediatricians and reinforce how important it is. So you are the trusted messengers, so it is critical that you get engaged in this issue and ensure that you're communicating with parents or their caregivers that they take the census, and that if there is confusion about whether or not a child should be counted, address that with them. We're also partnering with some other groups that we work with in our coalitions. So for example, from the child care perspective, early learning perspective, child care centers. As I noted, we do work in home visiting, so home visitors, but really trying to get into that ground level to make sure that the folks that are interacting with parents and caregivers on a daily basis are aware of the importance of the census. So just a few quick notes here. Please make sure that you're hanging up that poster in your exam rooms. We have the link there to the Sesame Street census video. and really just, to the extent I know, I'm the parent of a 2-year-old and a 5-year-old, and I know how hectic some of the visits can be, especially when, you have a patient that is not ready to get a shot or doesn't want to be weighed, but to the extent that you have some time in those visits and can make mention of the census, I would certainly encourage you to do that. And I think, again, really that messaging that we found to be so effective of this is only 10 years and it's so much of a child's life or child's childhood, we found to be really effective. And again, at the end of the day, if there's a kid living in your home on April 1st, make sure that kid is counted. So with that, you can see my contact information there, and I will turn it back over.
Thank you so much, Carrie, and thank you everyone for your fantastic presentations. We have just a few minutes left, so we can go ahead and open the webinar up for questions. If you do have a question, please type them into the Q&A box to the right-hand side of your screen. You can also ask over the phone if you are dialed in by pressing #6 on your phone line to unmute your phone, and you can go ahead and ask your questions to any of the presenters. We'll go ahead and see if we'll give it a minute to see if we have any questions. Okay. Well, if you think of a question or if you are one of the individuals that's watching the recorded version of this webinar, you can submit your question to info@paaap.org, and we will be sure to respond or push your question out to one of our fantastic presenters today to have them respond to your question in a timely manner. So we'll go ahead and conclude the webinar for today. Thank you again to all of our presenters. And just as a reminder to receive CME or CEU for your participation today, please complete the steps provided in the email that will be sent to all participants following the webinar. If you do not receive the email, please contact us again at info@paaap.org. Thank you, Pennsylvania Partnerships for Children and the U.S. Census Bureau for your fantastic collaboration today. Have a great afternoon.